Allergic rhinitis has two components that needs to be addressed. Firstly, the itchy runny nose that just cannot stop sneezing. Antihistamines can be life-changing. However, it's very important that you choose the correct antihistamine that does not affect your productivity. Mild congestion will respond very well to antihistamines, and that might be all that's necessary. Secondly, we need to address the congestion. Once our blocked noses become severe and persistent, we need to add intranasal cortisones. The frustration of the allergy sufferer is that once they stop their medication, all their symptoms come back. Allergy medication only controls your symptoms. It does not take it away. How to choose an antihistamine for you or your child? There are two types of antihistamine, first generation and second generation. First generation antihistamines are often perceived to be stronger and better because they make us drowsy, when in fact the opposite is true. While we might believe that it will give us a good night's sleep, it actually interferes with our natural sleep rhythm. When we give these antihistamines to children with allergic rhinitis that are already struggling to breathe and sleep at night, they wake up the next morning with a hangover from their antihistamine dose the previous evening. First generation antihistamines are often found in cough syrups, cold medication, as well as sinus medication. Despite their well-known and published side effect of drowsiness that has caused plane and vehicle accidents, they are still readily available over the counter. The second generation antihistamines were developed to combat all the negative side effects of the first generation. Second generation antihistamines are classified as non-sedating. Within this group, there are two categories. Those with minimal crossover into the brain but are still regarded as non-sedating. Those with no crossover into the brain, such as fexofenadine, that do not cause drowsiness. How our body processes and gets rid of medication is very important. These medications get altered by our livers and our kidneys. This is important in the elderly, as well as patients with liver and renal impairment. In them, the medication dose needs to be adjusted. Fexofenadine gets excreted directly and does not need to be processed, thus, no dose adjustment. Choosing an antihistamine is very easy if we prioritize safety and efficacy. Once we have the correct medication, we need to stay the course with consistent administration.